So I'm Dr. Wayne Duffus. I'm the Medical Director for the South Carolina Department of Health and Environmental Control HIV-STD Division here in Columbia, South Carolina. I've seen many patients who come take their medicines every day, who maintain 1 or 2 jobs, take care of their family, go off to work, pay taxes, and do really great. And you can't look at someone and tell whether they have HIV or not. And I say to patients, the way someone's going to know you have HIV is if you don't come into care, don't take your medicines, and end up going to the hospital 3-4 times a year. Another thing that we've seen is the growth in the proportion of infected individuals who are females, who traditionally report high-risk heterosexual encounters. One thing that's very heartbreaking is, being an HIV provider, you'll have young individuals who will present to the HIV clinic, but they themselves have seen doctors in years before and were never tested for HIV. And so the question is, could this have been found sooner? So I think it's a failure of the healthcare system to address that. I think since we know that someone who tests early does better, respond to the medicine better, if you can get someone on medicines, you lower their viral load, so they're less infectious, so less risk to their partners. I think it's one way of stemming the tide of the epidemic, and it should be a part of how you get your glucose checked, you get your blood pressure checked, you get your cholesterol checked. You only know you're HIV negative if you've had a negative HIV test. And I think as physicians we need to lead. We need to educate people. I think we haven't really played a very active role when it comes to prevention. And I think there's prevention for negatives, people test negatives, and there's prevention for people who test positive. And I think providers need to take a more active role at addressing. So I think routine testing is long overdue.